So what exactly is a cardiac arrest? Well, under normal circumstances, your heart beats. It beats about 70 times a minute, which means that's about 2 billion beats during a normal lifetime. And that beating happens because electrical signals starting in the pacemaker of the heart spread all the way through the heart muscle and make the heart contract regularly. In a cardiac arrest, that beating stops. And often it's because of an electrical storm in the heart. The electrical signals aren't traveling in an orderly fashion across the heart, but they're like a hurricane around the surface of the heart muscle. The heart stops beating and no blood is getting to the brain or to the other vital organs. And actually, after a few minutes, if nothing is done to stop this, the person will die. So what's required to fix this electrical storm around the heart? Well, a device called a defibrillator or a heart restarter can be used to pass an electrical shock through the heart muscle, which resets the electrical signals, gives the heart a chance to start beating normally again and pumping blood around the body. An automatic defibrillator can tell when the heart needs a shock, and without any instructions from the outside, can deliver that shock in such a way that the heart restarts properly again. So automatic defibrillators are quite easy to use. Often people are quite concerned about them because they're a medical device and a piece of technology, and they're quite frightened about using a defibrillator. But actually, they're designed to be completely simple. Place the pads on the chest of the patient, the machine tells you using voice prompts exactly what to do, and then the machine itself will analyze whether a shock is required. If a shock isn't required, then nothing will happen. But if the patient does need a shock, then the defibrillator will give just the right amount of electricity in order to restart the heart. It's not possible to do harm with an automatic defibrillator. It won't shock the patient if a shock is not required. But if it's used correctly, it can save a life.